Welcome everyone to the Commonwealth Club of California. I'm Tony Beretta, Senior Vice President of Government Relations for Kaiser Permanente, and I'm delighted to welcome you to this important virtual program exploring youth mental health, the impact of COVID-19, and how best to move forward. At Kaiser Permanente, we take care of many, many young people, and we've studied youth mental health issues for a long time. Back in 1999, a Kaiser Permanente study conducted with the Centers for Disease Control and Prevention was the first and one of the largest to identify the link between adverse childhood experiences, or ACEs, and health over a lifetime. From that study, we've identified the problem of ACEs on mental health and focused on solutions. I've been working on public policy in the mental health space for my entire career, from serving on the board of the East Bay Agency for Children here in the Bay Area, to years working with the Public Health Institute, and of course, many years here at Kaiser Permanente. Over all of that time, one consistent theme has been that organizations and people providing mental health services to young people face many challenges that are not obvious to the rest of us. There are multiple drivers of this: a lack of resources, a lack of understanding of the problems, or a lack of coherent public policy. Many in the field and on today's panel have ideas on how to solve these problems, but they run up against barriers. And now we face the additional hurdle of the impact of the pandemic on the emotional and mental health of so many. As the country opens up, America's youth may have a long struggle ahead of them. One of the most important things we can do is to gather thoughtful people together to have conversations about the problem and to explore how we can do better as a society. And that's why I'm very happy that Kaiser Permanente is sponsoring today's session. Our panel of experts will discuss how to treat and mitigate the impact of mental health trauma on young people. They will also share resources and tools to discuss support systems that are needed. One important note before we get started: we are likely to discuss serious mental health challenges, including suicide, during this session. If you or someone you know is in crisis, please call the National Suicide Prevention Lifeline at 800-273-8255. And now to begin the program, I'd like to welcome our moderator, Julia McEvoy. Julia is KQED's Senior Editor for Education and Equity. Her editorial work has received a Peabody Award and several Edward R. Murrow Awards. Julia will introduce our distinguished panel and conduct the conversation. Julia?
Thanks, Mr. Beretta. Appreciate that. I'd like to start by getting anyone who's here participating in our audience involved. We'd love for you to submit questions for this fabulous panel we have here with us, and you can do that by sending them via text chat. We'll get to those, as many as possible, later in the program. You know, we are here because we know young people are living through a worldwide pandemic. They're witnessing the murder of George Floyd and other Black men and women by our local police departments. And they are contending with the overall effects of climate change on their future in this planet. So yes, we are seeing increases in anxiety and in isolation for many young people, increased suicide attempts, especially among young girls. And in some hospitals, we're seeing the increase in the number of children seeking emergency medical services. Fortunately, we have an extraordinary group of speakers today who can talk about solutions and what's being done to help. I'm really excited to do this. So let's meet all of them. Dr. Patrice Harris is a psychiatrist from Atlanta and the immediate past president of the American Medical Association. A governing theme in her professional life is passion to improve the lives of children. Dr. Harris is also an adjunct professor in the Emory University Department of Psychiatry and Behavioral Services. Dr. Tom Insel, also a psychiatrist and a neuroscientist, has been a national leader in mental health research, policy, and technology. He previously served as director of the National Institute of Mental Health, and since 2019, he has been a special advisor to California Governor Gavin Newsom. Amit Paley is Chief Executive Officer and Executive Director of the Trevor Project, the world's largest suicide prevention and crisis intervention organization for LGBTQ young people. He began as a counselor on the Trevor Project's Lifeline in 2011 and still continues to answer calls on Trevor Lifeline. Before Amit became the CEO of the Trevor Project, he was an associate partner at the global consulting firm McKinsey & Company, and before that, a foreign correspondent for the Washington Post. And we have with us Arthi Suresh, a freshman in college. She was a student at Marjorie Stoneman Douglas High School in Florida when in February 2018 experienced the deadliest high school shooting in U.S. history. You may remember this. Arthi came to that school 2 months later, but seeing the mental suffering on her campus, she focused her energy on co-founding a mind-body ambassador program at her school in collaboration with the Center for Mind-Body Medicine. She has continued to lead mind-body medicine workshops for her peers, community members, and doctors to teach mental health coping skills. So glad you all could be here. Thanks for making time for this. Arthi, you're a great example of how solutions can come from students themselves. When you arrived at Marjory Stoneman Douglas, it was the year after this horrible mass shooting. What made you step forward and take action in that moment?
So although the massacre had happened a couple months before, it left an everlasting scar on everyone mentally, and there was a lot of PTSD taking over our school and community at large. And so even when the fire alarm would go off, just as a drill, it would trigger a lot of PTSD within everybody, or if somebody slammed a book too loud, it would trigger PTSD as well. And so it was really apparent that for us, school was no longer a safe place where we could focus on our education. Instead, we were always on our feet thinking about if a shooter is going to walk through the door at any moment. And so there was a lot of distractions, and students really couldn't find a calm inner self. And I think it's really important that students are focused on their education while they're at school and they don't have these distractions. And our administrators were focused on increasing campus security while the mental health of the staff and students remained unaddressed. And so to kind of bridge this gap between mental health accessibility at our school, I teamed up with the Center for Mind-Body Medicine, as well as a teacher and a couple of my friends at school, to kind of bring their work to our school. And so we set up weekly mind-body sessions in the teacher's lounge after school, and that kind of served as a safe place and time for students to open up about how they were feeling after everything they had been through. And every week we would learn a new mind-body skill, which would help us cope with the trauma that we had incurred. And so this model really transformed the mental health at my school, and I was given the opportunity to spread it all over my county. And then after that, I kind of took this work afar. I started teaching doctors and healthcare CEOs and spreading it into other education systems as well as healthcare systems all over the country.
Super powerful work. The power of student activism right there. So I love that. All right, let's move to you, Tom. In early 2020, you co-founded Humanist Care, which provides mental health support to students at the University of California, Berkeley. And I'm hoping we'll hear more about that a little bit later in this program. But this week you're launching Mindset News, which you call a platform for a new social movement for mental health. Why is a new social movement needed here right now?
Well, Julia, first, it's great to be part of this. I'm really looking forward to the conversation. You know, as you mentioned in the intros, my background is as a scientist. So I spent a good chunk of my career in a laboratory doing very basic science work, but became interested in the problems of mental illness broadly, particularly serious mental illness. Not limited to kids, but that's often where it begins because most serious mental illness begins before age 25. And in thinking about this, trying to understand why we haven't done better by people who are struggling with that set of problems, because the science is going great. We've had enormous progress in neuroscience and in psychological science, and we're able to now do things in genetics we couldn't have even dreamt of 20 years ago. And yet the problems of people with serious mental illness are worse, not better. We've actually made very little progress. More people homeless, more people incarcerated, fewer people recovering. And I was trying to understand that. And so Humanist came out of an interest in trying to figure out how do you move upstream, how do you provide really good services empowered with technology, but services that are focused on individual needs. And as we often say, services that focus on what's strong, not what's wrong, so that you give people the kind of support in the moment they need it. And Mindsight is really a different kind of an effort. I'm glad you asked about that. We're hoping to launch this week. It's really the result of realizing that what we need to be able to bend the curve for people struggling with a whole range of mental health problems is more than just more care. It's actually reframing what we think of care and beginning what I call a social movement for mental health. In so many ways, this is really the Jim Crow era for people with serious mental illness. They are not even on the bus often. They're every place except where they need to be in care. They're not getting the supports they need. And so much of what they need is not typical medical care. While I think the problems can be defined as medical, the solutions need to be much broader. They're social, they're environmental, they're political. And so part of what we're about here with Blindsight News is beginning a national conversation. It's a daily newsletter. It's a long-form journalism, solution-focused journalism effort to bring attention broadly to the issues for kids and adults with and families broadly who are struggling with mental health issues, and to point out that we actually do have good solutions. We just haven't deployed them. And the real challenge, I think, is to get that social movement going to make sure that we do what works for the people who need it when they need it in a way that they find acceptable.
Terrific. Look forward to following Mindsight News in the week ahead to see what happens there in the first story. Patrice, you've argued and lobbied for a more holistic approach to helping children who have experienced trauma. Why is that important inside schools right now, especially for young people who are coming back to schools from communities that are hardest hit by COVID-19?
Let me just say, I also appreciate the opportunity to be on this panel. And listen, you've heard already two folks who are moving to solutions. But for me as a child and adolescent psychiatrist, and I've said this often about anyone on the front lines, we have a front row seat to what's not working in our systems. We see that every day. And I so agree with Tom. We have to move beyond the walls of our offices and our clinics and our hospitals, because having that front row seat, we see all of the determinants of health, right? Not just mental health, but when we think about poverty and transportation and lack of access to care and a workforce that's well trained to address trauma, and really a misunderstanding of diagnoses. And finally, I could go on, but finally I will add, not appreciating the opportunities for prevention when it comes to mental health in general, and particularly children's mental health. So for all of those reasons, the importance of integrating care, the importance of addressing unmet needs, it's been a passion of mine to advocate for better services.
Terrific. Thank you. Amit, the Trevor Project does amazing things to help meet the mental health needs of LGBTQ youth, right? Including using surveys to gather data that can help shape policy. You just completed a national survey on LGBTQ youth mental health recently. What struck you the most out of all that data that you collected? What sort of stuck with you?
Well, thanks for the question. And I'm really glad to be here with such inspiring leaders in the mental health space. I think what I was struck by was how much work we still have to do. The survey found that 42% of LGBTQ young people seriously considered suicide in the past year, and more than half of transgender and non-binary young people seriously considered suicide. And then when we looked at that broken down by different types of groups, we saw that LGBTQ youth of color were at increased risk and had particular unique needs that were not being addressed by society. And in some cases, actions taken in society have specifically attacked and made some parts of the LGBTQ community at greater risk. The other things that I think were really striking in this survey, we found that 94% of LGBTQ young people said that recent politics negatively impacted their mental health. You rarely get a number that high. I mean, that's basically almost everyone said that that their mental health was negatively impacted by the political climate. And we can talk a little bit more about how that has been so difficult for LGBTQ youth. And they also said that the pandemic was dramatic, again, no surprise, but upsetting to see, was dramatically impacting their mental health. 3/4 said that their mental health was poor most or all the time during COVID-19, and that they were feeling more social isolation during the time of the pandemic, which was part of what was causing them to feel in distress.
Wow.
So a lot of work to be done to create a brighter future for young people, including those who are most marginalized and at risk.
Very, very intense. Well, let's talk about solutions. That's why we're here. This is all heavy duty stuff. And we know we want to try to figure out where points of light and inspiration and what we can do. So some schools are creating trauma sensitive classrooms. Others are helping train teachers in anti-racist curricula. I'm curious where you all see K through 12 schools or higher ed institutions succeeding in meeting the challenge of this moment, particularly when it comes to the unique challenges of young people who are that are bringing with them, depending on their race, their class, their gender, their disability, their immigration status. Can each of you or any of you describe some of the things that schools are trying right now that you have your eyes on? Arthur,
Well,
you could leap in if you want on the trauma sensitive classrooms. I think that's something that you're super familiar with. Sorry, Patrice, I don't know if I cut you off there.
Yeah, I've definitely seen an increase in the amount of schools that are participating in setting up trauma-sensitive classrooms. I think another thing to think about when you're thinking about integrating mental health into the curriculum is really starting from a top-down tier model, in that you're training the teachers and administrators before you bring the work out to students. I think that's so important, because as a student, I know that like when I tried to bring like mental health initiatives into my own school, like my principal at first, she tended to like prioritize other issues within the school rather than mental health. So I think it's really important that the teachers and the administration know like what it means to be culturally competent and what it means to really give students a sense of care and a place where they can be themselves and open up about these situations and not stigmatize them for having these mental health issues is going to be really, really important, because sometimes they can be a little submissive with attitudes when you're bringing in mental health. And then another thing is, usually when you do bring mental health into the school system, you have teachers that are teaching mental health mental health trainings to your students. And so it's hard for them to help students when they don't even know how to utilize those mental health initiatives on their own as well. So it's really important that they're helping themselves before they help their students. So that's why I think a top-down model in the education system is so important.
That's interesting. I was thinking of a bottom up to the top model where students are asked what they need. So that's a great point. Other things that the rest of you guys have sort of seen happening in schools that you see is working, that you see is sort of meeting this moment, if you will, because everyone's quite well aware of this behavioral health crisis that youth are facing right now.
Let me just add that we are seeing more and more schools bring mental health services into the schools. But I really like the point that Arthi made, and we typically think about mental health in terms of a diagnosis or an illness, and that is a part of it. But I believe, having spent some time as a public health director, as a psychiatrist, that we need a public health approach. First of all, we need data, and I really loved what Amit did. He went out to get the data, and he got the data based on populations. Oftentimes we are lumpers, right? We lump data and then we turn our attention to the middle. And we really need to be committed to disaggregating the data, getting it by race and ethnicity, even zip code. And certainly based on gender, sexual orientation. So then we have targeted interventions and know where the issues lie. But bringing school-based services is key. But how about routinizing those services, not waiting until there's a problem, but making it okay to not be okay and to talk about issues daily, weekly, just on a routine basis. And I do want to point out, last year, we still need public awareness. COVID certainly has accelerated, but there's still a lot of stigma, particularly in communities of color. You know, we've seen issues around the vaccine and candidly, mistrust and distrust of the healthcare system that is based in some fact. And so we need to make sure we are going into communities using trusted messengers about vaccines, but also about mental health, and making sure that everyone has factual information and then the services that they need. And one more quick point, because you mentioned at the very beginning about the increased suicide in youth, particularly among young Black boys, we are seeing an increased rate of suicide.
Wow, it's intense. At the higher ed level, I feel like Tom, you or Amit would sort of be able to jump in terms of college institutions or community colleges. Do you know anything that's going on there that is actually stepping in and helping students get the mental health services that they might need in some way?
Well, I'll jump in very quickly. The demand is out of sight. I mean, people have not seen the kinds of needs and demands for services that we're seeing now. Some of that is generational. So we talk a lot about stigma in this space, but there's much less of that in the college generation that is in college now. They're quite open and quite willing to seek services. The reality is that the services have not been there. And one of the things that is actually kind of a silver lining of COVID is that many schools have realized that whatever it is they were doing through their counseling center or through their health center in the past is not going to cut it going forward. So you see a lot of innovation. One of the things we've been intrigued by that Humanest has pioneered is a sort of one at a time therapy, the idea that you don't have to log somebody in for a 50-minute hour once a week for 7 weeks or 12 weeks, whatever it's been traditionally. But you meet people when they need it, where they need it, online, and you're able to respond within a matter of hours instead of these several week waits to be able to see somebody. So it's more of a kind of crisis orientation. Not great in some cases because we don't want care to be crisis driven, but we're in that mode right now because of the enormous demand. So I do think there's a lot of innovation. There's interest in using technology. There's interest in finding ways to support students. And I must say, I think one of the really powerful opportunities here is to have students support each other. So building out the kind of networks that have been really important in other areas, that to recognize that students have a lot to offer each other and that helping someone else is often the most therapeutic intervention you can provide.
So many important points made. I might just jump in that I think in talking about the things that are really inspiring about young people, that they are changing the conversation, especially around some topics that have been, I think, really taboo and stigmatized, mental health in general, but specifically around suicide. We are seeing both in the college level and also in the K-12 level that more schools are feeling comfortable talking about suicide. Suicide is the second leading cause of death for all young people in this country. And yet there are so many places where people are afraid to even say the word suicide or to ask people if they are thinking about suicide or killing themselves. And I think it's important for anyone listening to know, in case you might still have misconceptions or some of the myths that what if I ask someone that question, might it put them in danger or more likely to harm themselves? That is not true. The research all shows that asking someone if they're thinking of killing themselves not only does not hurt them, but in fact can actually help them, because it allows you to have a conversation that might surface what someone is actually thinking and allow them to get help. And we are seeing school districts beginning to put into place model school policies on suicide prevention that Trevor Project and some other organizations like the American Foundation for Suicide Prevention have worked on together. There's a long way to go, so I don't want to make it seem like it's a rosy picture. It is not. There's still a lot of stigma, but I think this pandemic has made clear to many more people that it's important to have these conversations, and is hopefully helping us to erode and break down some of those stigmas.
Amit, I'm really glad you spoke directly to that kind of conversation and not being afraid to have it. One of the questions that one of our audience members has sent in here is, what can family members do to help mitigate the impact of all the isolation during COVID and the fears of the variant that remain, even as kids go back to school and out into public? So I think if you suspect, if you have concern about someone, a young person that you care about in any way, shape, or form, as a friend, as a parent, as a caregiver, asking questions, I guess, is what you're saying is okay to do. Don't be afraid to open that door. You guys have all sort of touched on, well, Tom, I would say you and Amit and Arthi certainly have touched on technology as sort of, I think it's like this double-edged sort of sword here in this discussion, right? Because we know that it's been helpful. We know that the internet and digital devices helped us stay connected with schools during the pandemic, but they also further isolated some youth in ways that hurt many of them. And, we've got another questioner in a question from our audience in here sort of asking about that. Phones can be diagnostic tools and offer help, but they also can be conduits for bullying and negative messaging around suicide, for example. So I guess what I'm wondering from y'all is, what will it take for technology and social media to be used for good in this current mental health crisis? Do you see it as an opportunity for good? Do you fear it can, go haywire here? What would be in place that could make it work out in this moment and help?
Maybe I'll jump in, Julia, because I've been kind of in the middle of a lot of that and trying to think about how do we use technology? Where do we innovate here? How do we do better? And I think Patrice did a nice job of explaining how we really need that. We're not getting to what we need, and particularly for kids, because that is the world they're in. It's a digital world. That's we talk a lot about the digital divide. Most people under the age of 25 are very much in the digital space. So how do we make sure that they're getting benefit and not harm? And it's true for every technology. They're always double-edged, and it's really not the tool so much as how we use it. I think we're still early in this process of figuring out how to use technology for mental health as opposed to having technology be a threat to mental health. The conversation often goes towards, what about all those apps? And I think if you look, because there are thousands of apps now for wellness and mental health and meditation and a range of things, where I think the real promise has come from is not the use of apps per se, but using technology to improve access to care, to improve the quality of care, to begin to measure outcomes in a way. And Meet spoke to this with that survey, so that you begin to really get the kind of data that you can use to help people, so people know what's working, what isn't, and know how to get to things that actually work. And if you look, because there's been an enormous investment from the private sector in companies that are doing this kind of work, the ones that appear most successful are the ones that are actually providing services that people want in a way that they want them. And I have to say that what we have done traditionally in this space is not that. We have built a mental health care system for payers and providers, but not for consumers. And if nothing else, I think what the technology revolution has done here is to invert that and to ask people, what is it that you actually want to engage with? Because the engagement rates for mental health care have been so low, particularly for young people. 60% are not getting care when they need it. That is not true in the rest of medicine, but it's really true here. And so figuring out how to solve for engagement is hugely important. And I don't think it's been done, but I think there are many, many innovators and developers on that path. So I'm kind of hopeful that we may be in just like the first chapter of a multi-chapter book, but I think by the end, we'll have something that will be much better than having only 40% of people engaged in care when they need it.
If I could add, as I've said about technology, there's both promise and peril. And, we can say that, as Tom said, about so many other things. And so what we want to make sure we do is have these conversations and be intentional, just as we are, hopefully most of us, having conversations about being intentional about anti-racism and health inequity. We have to be intentional about thinking through the potential perils, right? Because technology could end up, and we've seen a couple of examples already, not necessarily related to mental health, where it worsened health inequities. And so we have to have these conversations. And I would add, and this is just sort of a personal thought here, all of the wonderful, smart, brilliant folks who are innovating, I hope they are thinking about not just innovating for innovation's sake, but solving a problem and including patients, including physicians and other healthcare professionals as they are developing, so that, again, they are intentional and realize that it's not a shiny new object. And when you get things wrong here, people could die. And if you have those conversations, and with that in mind, you can not certainly eliminate, but mitigate some of the risks.
I agree with so much of what was just said, and I just to make sure we are being insert some data, because we like to be data informed in what we're doing. Our national survey actually asked what the impact was of social media on the mental health of LGBTQ youth. 96% said that it positively impacted their well-being, and 88% said it negatively impacted their well-being. So basically, almost everyone said it has both positive and mental and negative effects. But I think we really, I really appreciated Patrice's point on focusing not just in general on the impacts of technology, but also the impacts of technology for good and for bad on specific groups and specific populations, especially those who face the most discrimination, isolation, and lack of access. At the Trevor Project, we started a decade ago to say, how can we reach young people where they are? We're traditionally a phone lifeline. Suicide prevention lifelines are traditionally by phone. And we wanted to start to move towards chat and text. And there was a lot of resistance in the field, people saying, well, you can offer services via chat and text, but you can't do suicide prevention work. You can't do crisis intervention work. That has to be done by phone. Again, not based on any data or research from people on what they actually needed, based on conceptions that people had. And in fact, once we began doing that work and the field has now moved, we saw that there are some populations at particularly great risk that particularly prefer digital even more than the general population. In our case, trans and non-binary young people much more strongly prefer digital for getting help than they did phone for what could be all sorts of reasons. Same with certain populations of youth of color. And so I think when we look at what are the interventions, what are the programs and services that we develop, we really need to focus on what it is we are hearing from young people and try to be targeting what we are developing to meet their needs, not our conceptions of what would be helpful for them.
Yeah.
Julia, can I jump in here for a moment? Because I think Amit makes a super important point. We're in the middle of a transition in the United States to a new crisis response system called 988. So by July 16th of 2022, every state will need to have a 988 number available for anyone who has a mental health crisis, as opposed to using 911, because the idea is to move away from police and fire responding to a mental health crisis. Super good idea.
Yeah.
What's been so fascinating, and this is really what Amit's getting at here, I think, is that we're not thinking well about how to do this. We're thinking that, like with 911, people should just call a particular phone number. But we know when you look at crisis services for young people, particularly for people under 18, they don't use their smartphones for calling anybody. They text everything, or sometimes they'll use chat. So it is important to start to introduce this point that Amit's making, that as the nation in every state begins to implement this new set of services, and it's really targeted for young people in crisis, that we use the mode of response that people actually want. And unfortunately, that doesn't seem to be happening. We still have a kind of 1990s approach to this, thinking that people will call now not a 10-digit number, but a 3-digit number. We need to really begin to rethink how we approach this and begin to put in the tools that allow for people to chat, to text, to access services in any way that they find comfortable and private.
Arthi, do you see, I want to hear your thoughts on if you think tech's, working in a good way for students on campus.
Yeah, I definitely think technology has, can be used and can result in amazing ways to help with mental health. But another thing that we need to think about with this conversation is sometimes making mental health accessible with technology can also result in barriers for kids who don't have access to technology. And so it's kind of like creating a gap there as well. But in terms of how it can positively impact mental health, I would definitely say that we need to be thinking about applications that are using a comprehensive approach so that they're allowing multiple different outlets of how especially students can cope with their mental health. Just like Tom had said, like you need to be kind of developing these programs based on what kids or students actually need in them. So that's why it's really important that there's multiple options within these apps of ways that kids can interact with the mental health assistance that's being presented to them. So I definitely think with 988, having a call center is going to be really beneficial, because for a lot of kids over text, it's really hard to communicate how they're feeling. And so they would rather do it through like speaking. But for other kids, it's hard for them to kind of open up and be that transparent. And so they kind of like to be like, they like to have the phone as kind of like a barrier between who they're talking to and who they're presenting their feelings to, because they want to feel kind of safe and protected. So it's really important that you're just presenting a lot of options for anybody to use, because you never know what works for anyone else.
Yeah, that's great. And I'm really happy that you reminded us of the incredible digital divide, which was highlighted in the distance learning rollout when we saw especially students in rural areas simply not being able to log on, and also students living in public housing projects that didn't have good internet access and broadband, also having to, do work from school buses. So imagine trying to access mental health, even on an app on your phone in that situation. So I want to kind of bring in a comment from our audience asking us to talk about substance abuse. It leads me to a question I'd wanted to ask you all about sort of the intersection between mental health and addiction issues. It seems like we've historically treated these separately, these two domains. And I'm wondering where you all have seen institutions that are creating a more interdisciplinary approach here, where people can get their needs met in one place. Do we have systems that are talking to each other? And I think this is going to be really important in the continuum of care when we see states like California, rolling out new sort of giant investments in behavioral health and youth well-being, trying to merge giant systems and institutions that have operated separately. So talk to me, if you can, about why it's important, or maybe who you see out there right now that have created places where it's a one-stop shopping for someone who's coming in with different issues. If it's an interface between substance abuse, that's also a mental health concern at the same time.
I can kind of speak on this in like the educational setting. What we have at our school, and I've seen at other schools when I was in high school, is a peer counseling system. And so Tom had kind of mentioned this before, but it's really important that like students are offering their peers help as well, because students really do like use the students' help more because they like relate to them. So I think like for our school, we had peer counselors. And so like if a student was struggling with mental health or substance abuse, because after the massacre, a lot of students at my school would do hard drugs or alcohol to kind of cope with what they were going through. And so substance abuse was a really big thing. And so we had our peer counselors who were just normal students at our school. They were trained in suicide prevention, being like culturally competent when it came to mental illness, and how to kind of handle talking to students who are struggling with substance use disorders. And that would kind of help a lot of students in our school, because it wasn't like drawing a negative line to substance abuse. It was more like bringing an open conversation to them. And I think a peer counseling program can be helpful in schools across the country, because it really does draw this, like, it steers away from the stigma and rather brings in an open conversation when you're talking about that.
Yeah. Anybody else?
Julia, I'm sad to say that I don't know of any model programs at the moment, but the good news is people are talking about the fact that we need to break down the silos between sort of certainly overall health and mental health. And that does include substance use disorders, but you are right, for so many years. And this is for many reasons. Even when folks are willing to talk about, mental illnesses, there was even greater stigma against those who had a substance use disorder. They were weak. They had a moral failing. If they would just stop, using, everything would be okay, not appreciating the fact that this is a brain disorder. And Tom, one of the brilliant neuroscientists of our time, and others have, elevated what we understand about the brain. So the good news is we are on our journey, certainly the very beginnings of our journey, even though we've known that these disorders co-occur very often. So I think as we continue to grow, we need to make sure that when you are paying for a service, because a lot of times it was due to financing or sometimes regulation. And so we have to address this from many issues, from healthcare financing to regulation, to make sure that these services are integrated, again, into overall healthcare.
Maybe I'll just jump in quickly at some of the things that I'm pretty hopeful about. I mean, a lot of what we've talked about, and Patrice has brought this up, is all the stuff we need to do around social determinants that aren't even part of care.
Right.
But if you look at the care system we have, I think what's really striking is how fragmented it is. So It's not just that mental health and substance abuse are separate, but they're both separated from primary care.
Right.
And you've got different data systems, different providers. I mean, just even different language. That's a lesion that does have to be fixed. And increasingly, you see a real interest in attacking that particular problem. So the term of the day is whole person care or no wrong door care. There are lots of different ways of talking about this. The Certified Community Behavioral Health Centers, the CCBHCs, were set up now 4 years ago as a pilot, 2 years ago as a broad, comprehensive program for the nation, 430 clinics across 40 states that are doing whole person care for people with serious mental illness and substance abuse as part of that, and crisis services, rehabilitative supports, lots of other things. It's the first time, really, Julia, since the 1960s, when the federal government is saying we need to get back into the act of really helping people with mental illness. And we have to do it in a way that's comprehensive and compassionate, and it's not just about medication, it's about rehabilitation and recovery. And so setting up these 430 clinics has been a big deal very quickly, just done really mostly in the last 2 years. They're still, they don't have sustainable funding, many of them, but we're on that path to integrate care across these different silos. And I think that's a really exciting moment. It's not something that most people would know about, but it is, I think, the beginning of a new generation here where we start to take care of the fragmentation. Lots to do here. We don't have the workforce. We don't have all of the infrastructure we need, particularly for the data integration, but we're on the path. And I'm actually pretty hopeful that that's a problem we can solve.
I mean, Amit, do you think that the healthcare industry can become more inclusive when it comes to how it's interfacing with LGBTQ youth who often feel discrimination when they go in to get help? Are there any points of light there where you see institutions or healthcare interfaces that are getting this right or making access easier for people? I mean, other than, through the phone.
We are seeing progress on that, and there are definitely institutions, providers who are focusing on making sure that they are really training not just the providers, but all parts of the institution and all the ways that an institution acts with a patient or with a young person to be inclusive. So that ranges from making sure that providers are not making assumptions about someone's sexual orientation or gender identity, that they are trained to understand what different types of sexual orientations and gender identities are. So when someone is sharing something very personal about them that maybe they haven't shared with many others, that they are met with understanding and empathy and support, not questioning or even judgment, or in some cases discrimination. But it also includes the whole setting. If you're a trans or non-binary young person and you are going in to see a psychologist or a psychiatrist who maybe is trained to be supportive of you, but you go to use the restroom and you realize that you don't have a restroom that you can use because you're a non-binary person and there aren't restrooms set up for you, or you're filling out forms and there aren't, when you're completing the forms, you are not seen there and you have to check some box that doesn't reflect who you are. That impacts your sense of self and how you're going to feel accepted and part of that institution. So we have a lot of work to do. and many institutions, I think, are starting to say they care about these things. Not all of them have actually put the resourcing in or done the work to truly transform the way that they're operating to be inclusive for LGBTQ young people and for all young people of all backgrounds and identities.
Thank you. The funding question, of course, looms large in front of us. And, we know that schools are getting a lot more COVID relief dollars. These are one-time funds, but they are trying to figure out how to best spend them right now to be most effective in meeting the needs of students. And I guess what I'm wondering is how you think that money could best be spent to try to create more access for students and get their needs met. I think, the thing that leaps out, I think probably is just the tremendous shortage that we have of mental health counselors and psychiatrists trained to work with children. We've got this shortage of therapists, in schools nationwide. Should they be spending these dollars to try to bring in a couple different more therapists, if they could find them, into the school setting, into a wellness center and that sort of thing? Or, I had another head of behavioral health at one district say, we've got to get all teachers trained on being eyes on the game here and creating spaces in their classrooms for healing in their classrooms, making every teacher, take on that role in addition to being an educator and being a social services person, sense of how they often have to also look more holistically at all the issues that kids are bringing in, right? So back to my question, we got some money coming in here. How could schools best spend this money to do the most good right now with kids who are coming in the door with issues?
Maybe I'll jump in because being in California, we're kind of right in the middle of that. So within the last couple of months, the California legislature and the governor have signed a commitment of $4.4 billion to youth behavioral health issues. That's, I think conservatively 100 times greater than any previous commitment to this issue by any governor in any state. It's a big deal. It's a historic commitment. But how should that be spent? What do we want to do with that? And where is that going to go? How much of that is upstream, dealing with what we call dyadic care for infants and dealing with ACEs and the response to helping with adverse child events? How much of it is in the schools? How much of it is in post-secondary? Lots of issues we're looking at. The one that has become front and center already in that conversation is workforce. It's not so much the what, but the who. Who is going to provide the services? And do we want to double down on what we've been doing and provide more like fuel for the system that we have now? Or should we step back and rethink what would be the ideal? What could it look like? And it turns out there's some interesting experiments that have been done elsewhere that are pretty extraordinary. There's a future proofing project in New South Wales in Australia, in which every eighth grader becomes part of a really massive effort around mental health and mental wellness, which looks a little bit like what America does for physical health and sports. It's pretty interesting. There's efforts in certain states that are pretty exciting. It's even some in California that are really promising. I would say that the two things that are already quite obvious is that, to your point, Julia, I don't think we can ask teachers to take on a lot more that are already overwhelmed with what they've got, and asking them to become mental health counselors or mental health experts. Well, I'll just say we tried that with the criminal justice system, asking police to become social workers. I don't think that worked out so well for us. So I think we can learn from that experience, and what we ought to be talking about is who that new workforce is going to be. The second point was realizing that the workforce we have now doesn't match the demography of California.
Right.
And that whatever it is we create has to be a workforce that speaks the language, understands the culture, lives in the geography, and can relate to the kids and families in that neighborhood. So people from that neighborhood becoming part of the solution. And that may be something like, we had Teach for America. Maybe this is Coach for California and setting up a whole new workforce that does that, perhaps using the community college system as a basis for recruitment. So I think there's a lot we can do. There's a lot of excitement here in thinking about this. California has traditionally been, as our governor likes to say, the nation's coming attraction. And so this could be a preview of what we could do nationally now that we have a commitment of the funds and the financing, if we can figure out the best way to do that to create really powerful and I would hope really transformative opportunities for kids, families, and schools.
Well, there's a million questions I have right there, but I want to look to our audience questions and honor them as well. And, one person is bringing up, this idea that athletes have recently been making their mental health challenges public. Yeah, we've seen Naomi Osaka and we've seen Simone Biles, my goodness, making her trials and tribulations front and center of her tour right now. It seems extremely powerful. So I guess the question from this person is, is this making it easier for everyone to sort of open the door on these issues? I think you all have spoken to a new openness of these sort of celebrity figures going public. Is that a good part of this? Do you see a ripple effect from that?
I mean, I do, because, we are a society of influencers and sometimes influencers for not so good, but sometimes influencers for good. And I have to say, so very appreciative of celebrities, Taraji P. Henson coming out, Naomi Osaka, as you say, Simone Biles, some of the professional, Kevin Love, NBA, talking about these, and that is very important, and I see that as nothing but positive. However, we have to realize that, and this goes back to your question about what should we do, and there is no shortage of things that we could do. I love Tom's issue about workforce, but I think it's about the who in workforce, but what are we training them to do? I was part of a conversation where a lot of the folks in the room said, we've been trained to take care of folks in the middle class, who may have a few issues. And so I think we need to look at even how we are training and what we are training them to be prepared for, and that it is not one size fits all, right? And I will say, side where the funds go, back to a point that I think all of us have made, we need local data. I remember having conversations about the opioid epidemic. I chaired the AMA's opioid task force, and I talked about the fact that the solutions needed for Marin County, California, the solutions that will work for Marin County, California, won't work for a small coal mining county in my home state of West Virginia. So whatever we do, and there's a lot, and we need those models, like Tom said, but we also need to keep it local and have the data inform how we spend those dollars.
Amen.
That's good. Somebody else is asking, what advice do you have for adults not to impose their own stress on kids? That's a very good practical question, I think. Caregivers are under a lot of stress themselves. Oftentimes that trickles down to the young people that they're caretaking of, and that's rough. That can be very rough. What advice would you have for adults to manage their own stuff so that they can then be stronger and more supportive of young people in their lives? People are throwing out here things like yoga and meditation, and what do you all turn to when you all are stressed? Maybe that's one way to get at this here.
Well, I might just jump in because we talk a lot about this in the context of caregivers, that if we are not filling up our own cups, we can't help others. We need to make sure we need to care for ourselves before we can properly care. Whatever metaphor you want, you need to put on your own, your own oxygen mask before you give it to someone else. We all say that, and it applies to parents or anyone in your life. It is much easier to say sometimes, I think, than it is to do in practice. And so I think really making sure you are carving out the time for yourself, because if you are not in a good mental space or emotional space yourself, you're going to take that out on others. And so I think, I don't know what is the right thing for that person, but to keep that mantra in their head of really focusing on your own care in order to be able to look at others as well.
We have another comment here about the political divide sort of adversely affecting young people. And I mean, you spoke to that, I think, in your survey. Your students really spoke to that themselves. But this person's pointing specifically to this nature of like, what are facts anymore? And sort of this sort of whole uncertainty of what is real and what is authentic maybe in front of their very eyes, and how that really rocks your worldview. Does anybody, Arthi, do you feel that students are able to ground themselves in, the madness of all this that's going on all around them? Is the political divide a part of it? Is this notion of what's real and what's factual a part of it, as this person is asking?
I definitely think that the political sphere can be sort of confusing to students in this day and age, and that can definitely affect their mental health. But I've also seen a lot of students use it as a way for them to express themselves in terms of their activism. And so it can act as an outlet as well. And so I think like when you're thinking about like bringing in like a mental health initiative, rather than kind of making it super specific to aiming at like handling these mental or these political influences, it should be more integrative. Kind of just referring back to your last question on how states can use this money is, I know that all schools like across the country, they have a PE graduation requirement for physical education, but there's nothing like a mental education requirement at all. So I think like really truly making it integrative into that sector as well can help, because a lot of people, they just do, okay, like boom, mandatory mental health training for one day. That's it. Like that's what we spent our money on. And then they don't follow up on it at all. That's like if we were talking about that in physical health, if somebody broke their leg and they go to like a doctor, they do surgery, boom, no follow up, no physical therapy. It doesn't make any sense, you know? And so like, I think when you start thinking about these political influences, maybe take a more integrative approach and more comprehensive, and then you can like specifically say like, okay, like is the political sphere affecting your mental health in this way? And rather than just kind of looking at that as like the starter influence.
Yeah, that's huge. Somebody else is asking, and I guess selfishly, I'm going to call this one out. What all would you like to see the media cover? Right. We're talking about amplifying solutions, or, what it is important to get out there. Tom, obviously you're launching your own media site for this purpose, but this person wants to know, what should the media be covering in terms of mental health challenges that young people face?
I would just say solutions, right? And the recovery piece. And let me just give you a specific example again, back to the opioid epidemic. But Julia, so often when you saw a story on the news, and these were sad stories and tragic, and they should be covered. Maybe you saw, two parents slumped over in a car and two toddlers in the back. And that did happen, not saying to shy away, but I didn't see enough stories about the person who has used buprenorphine, right? And they have returned to work and returned to parenting. So again, it's that part to show that therapies work, whatever the therapy is, treatments work, right? That's the part I would love to see covered more.
I agree with that. And I might just add in, we talked before about how there are systemic things happening in society that impact the mental health of young people. And we don't always make that connection. I sort of referred to this at the very beginning, but we talked about the negative outcomes around mental health for trans and non-binary young people. Well, right now in states across the country, there are lawmakers who are putting forward bills that are trying to prevent trans and non-binary young people from accessing medical care, trying to prevent them from using the restroom. And we don't always get the data put into that is making clear those decisions, which some people think about for political gain, actually have dramatic impacts on the mental health of young people. So I hope that we can take fact and evidence-based approaches to what is happening and make sure that we can actually see these connections between stances that people are taking and what we know from research and data and science, the impact that will have on the mental health of young people. If we can make that connection, we can hopefully stop doing the problematic things, do more of the good things, and improve outcomes for young people.
One of the things that California is doing, the University of California, it's got $15 million set aside for student mental health. And one piece of that is to help college students navigate, like get a sort of literacy, a health literacy going, which I found very interesting, so that students could navigate complex health systems and be better informed consumers. This sounds like a good idea to me. Is that ringing a bell with y'all?
And one conversation we've had is actually creating a portal. Canada did this at the beginning of COVID. They created Wellness Together Canada, which was extraordinary. They did it within about a month, and it allowed, even though that's a highly fragmented country in terms of healthcare, because every province does its own thing, it allowed anyone in any province to be able to access all of the services that would be available online, or even face-to-face if necessary. And so instead of trying to get the systems to integrate, it said, let the consumers integrate. Let them come in, see what's there, and they can begin to pull it together. We have a conversation about doing that in California as well, creating a statewide portal that would allow people to do exactly that, so they could see all of the options and be educated to know what is good for what, which is not trivial. That's a big issue. But I think there's real promise in that. It's one of the places we tend to talk about technology as being apps, but actually technology can be the force that actually brings a lot of the information to people in a way that allows them to navigate better.
That's really helpful. I know we're getting down toward the end of our gathering, and I guess I want to follow back up with the person who sort of wanted to know what we should be focusing on right now. You guys have covered a lot of amazing, you folks have covered a lot of amazing ground here. And I think if there, for the folks who have participated, if there were one takeaway, from each of you, something a person can do, a person could sort of get behind in terms of a lobbying effort or a political effort that's going on that you think could make a difference, or even in their own school or in their own household, is there something, words of advice that you all could share from your point of view about, just one important thing you wish folks could walk away from here today?
I'd steal Patrice's line. I think she said it exactly right. The most important and yet neglected fact in this field is that we have solutions. We actually can help people recover. We know what to do. And what is maybe tragic is we're not doing it. But there's no lack of solutions here. And I would love to see a greater focus on that.
Well, since Tom said that, I will just say, actually, I do want people to go away with giving themselves the grace and the space to feel how they are feeling and navigate this very tough time for all of us, because you do need, as Amit said, your cup full before you advocate and are on fire for these issues. So it's okay not to be okay. I have had my not okay days, and sought support from my circle of friends. Sometimes you do need professional help. So I would just say everyone should give themselves the grace and the space, but know that we are not hopeless. We are not helpless, and that help and solutions are available.
My takeaway would be that we need to stop dividing the importance between physical health and mental health, especially in education. Establishing that divide from very early on is affecting us to this day. And that if you are trying or helping bringing mental health initiatives into a school, make sure that it is truly integrative and comprehensive, and that it's allowing care for everyone in the space and not leaving out marginalized groups.
Such important and powerful things. We've talked a lot about structural and systemic change. And I know sometimes when we do that, sometimes it can leave people feeling a little bit, well, can I really make a difference? These are such huge changes that need to happen. And so one thing that I hope people take away is every single person can make a difference in your daily interactions with people that will help to improve mental health and reduce suicide. Some research from the Trevor Project came out, and it showed that having just one accepting adult, just one in an LGBTQ young person's life, can reduce their risk of suicide by 40%, 40%. And so I hope one takeaway is every single person listening, watching, being part of this conversation, you can be that one person. You can be a lifesaver by being someone who is being there for people, by being affirming and being supportive. Everyone can make a difference.
Thank you all. Very, very wonderful words of wisdom from everyone here. You've been very generous to share your expertise and your lived experience with all of us here, and I'm so grateful. Thank you for that. Just a reminder to our wonderful panelists who they all are. Dr. Patrice Harris, child and adolescent psychiatrist and immediate past president of the American Medical Association, Dr. Tom Insel, psychiatrist, neuroscientist, former director, National Institute of Mental Health, and special advisor to California Governor Gavin Newsom, Amit Paley, CEO and executive director of the Trevor Project, and Arthi Suresh, currently a medical student and co-founder of the Mind Body Ambassador program at her former high school, Marjorie Stoneman Douglas High School in Parkland, Florida. I'm Julia McAvoy, KQED Senior Editor for Education and Equity. We hope today's program has provided some new ways to look at youth mental health, and we thank Kaiser Permanente for their support of the program. And now, to make some concluding remarks, please again welcome Kaiser Permanente's Tony Beretta.
Julia, thank you so much, and thanks for leading just a terrific conversation. So many important lessons coming out of this, and I really do want to thank all of the panelists for the expertise that you've displayed, for your incredible leadership in this space, and all the essential work that you're doing. And of course, thanks to the Commonwealth Club for hosting this all virtually in our COVID times. A couple of very brief thoughts, because I think all of the presenters summed up many of the great lessons that we've learned here. But Dr. Insel's leadership, not just here in California, but nationally, has been remarkable. And much of the good that he referenced in terms of increased spending in the state, he had a very strong hand in making sure some of that happened. So I want to thank you for that. And we have a lot of work to do exactly what you suggested, is how are we going to spend that money, whether it's future-proofing on the Australian model or Coach for California. I love that idea. There's a lot to do, and we have the opportunity in front of us to do it. Dr. Harris, thank you for your tremendous leadership nationally. Integrating medical care is important, but I love the fact that you focused on going outside of the medical box and having this not be about the diagnosis and adopting a public health approach to mental health. I think that's a crucial lesson. Arthi, I can't say enough of just listening to you gives me hope for the future. Exactly the type of people who need to come into this field to lead us to a better tomorrow. And your ideas about how to make teachers leaders in their classrooms for all of their students and being intentional about the use of technology are lessons that we really need to take seriously. And Amit, just so wonderful to hear you and to learn about your work, particularly your notion about open conversations being something not to be feared, but really can be helpful to move forward. I think reframing the dialogue around mental health, encouraging a more open, proactive, positive approach to treatment and recovery really is going to be the key to our success in all of these dimensions. One way we're doing this at Kaiser Permanente is, and I think this came up in terms of meeting youth where they are, one thing that we've been doing is partnering with an esports organization to share positive mental health messages and interactive training. Right now, for every completed training on our website, iHeartMedia will donate $1 to the Trevor Project, up to $75,000. So we hope you can share these trainings with anyone in your life who could benefit from them. And again, I just want to thank our panelists today for leading this conversation, highlighting how we can continue to support young people and encourage them to prioritize their mental health. To close out, we're going to share a short PSA video we've created featuring the singer Lauv to encourage young people to prioritize their mental health and engage with our training. Thanks so much for joining us today.
Hey, what's up, guys? It's Lauv. It's super important to prioritize your mental health and to create a safe space for yourself and for others to do so. I've talked a lot about my experiences with loneliness, anxiety, OCD, depression. A couple of years ago, I hit probably the lowest moment of my life. Luckily, my friends, my team, my family were able to pull me out and encourage me to go find care, and started really taking care of myself through therapy and psychiatry, and then also picking up good habits like meditation. My friends and my family and my team and them opening up to me about their own experiences and supporting me. That's something that I wanted to be able to do, is to be able to speak a lot more openly about this stuff, because I just think it's really important. There's a growing community of people talking about mental health, thank God, sharing their experiences and learning how to help themselves and each other. So check out their Presence of Mind interactive video series to learn how to ask for help, step up for someone going through a mental health challenge, and normalize mental health conversations. Go to findyourwords.org/presence of mind.